It's also a great pleasure to be here and talk about 17 great achievements in the MindMatters program. And I know you've heard a lot about those and about the MindMatters program itself. So although I will say a few words about MindMatters, I wanted instead to talk a little bit about how that program, particularly its educational focus or its schools focus, fits into our broader program of initiatives in a psychosocial setting and in clinical settings for mental health for adolescents and young adults. It's been a very tumultuous couple of years, I think, in mental health. We got to a point late last year when research from the University College in London, conducted over 8 different countries, surveying about 1,000 people in all of those countries, showed that mental health was number 3 on the list of concerns Australians had about their country after climate change and the economy. So 2 fairly big issues at number 1 and number 2, issues that featured in the top 2 in every one of the 8 countries, some of them developed countries, some developing. But Australia was unique in putting mental health as the 3rd most significant challenge Australians saw facing their country. 35% of Australians nominated mental health in the top 3 compared to about 11% for the rest of the world. So something's been happening here in Australia to talk about mental health, to stimulate a discussion about how we can do better in delivering mental health services to the millions of Australians who experience mental illness every year. Probably, I suspect, had something to do also with Pat McGorry's advocacy during his time as Australian of the Year last year, which is why the discussion, although it was broadly around mental health services, focused in particular on youth mental health services, given that Pat is a youth mental health specialist, and that's why MindMatters is so relevant to that discussion. It's still, although there's been a good level of debate over the last couple of years, still mental illness remains not well understood in the community, even though there are very few families who aren't touched by it either directly or indirectly, and it's still a condition that attracts a very high degree of stigma and discrimination in spite of efforts over many, many years by many different governments of all political hues to really stamp out discrimination in places like workplaces against people who experience mental illness. So this is a very tricky issue. It's an issue very much at the forefront of the minds of many, many Australians. It's also, though, quite a unique health challenge, and it's unique for a couple of reasons. The firstly, of all the major health challenges we face as a country, cancer, cardiovascular disease, asthma, arthritis, all those sorts of things, along with mental illness is the only one that emerges early in life. All of those other conditions tend to emerge at our age, for those teachers, not the students, my age and beyond. Mental illness is something that tends to emerge early in life. We know that 2/3 of common mental disorders emerge before the age of 21 and 3/4 emerge before the age of 25. So if you do, as Susan described, take a philosophy in these things of prevention and early intervention, you have to get in at childhood and adolescence and very early adulthood. If you don't, there's a very serious risk, as you know, very serious risk, that mental illness can take hold and people can spiral into very serious disability at such a formative time of their lives when they're trying to finish their education, embark upon vocational or higher education training, and probably starting to live an independent life, gaining work. Critical periods of time which require very responsive systems of early intervention. The second reason why mental health or mental illness is unique among our major health challenges is that clinical interventions only take you so far. Mental illness is unique in that as much as a good clinical support, people experiencing mental illness need good housing. They need good support to be able to remain in a workplace or get work. If they're young, they need very strong supports to be able to continue their education, or at least, if interrupted, to resume their education, their training as soon as possible. These are things that the health system is not well equipped to do, which is why so much of our focus over the last year or year and a half at a Commonwealth government level has been trying to integrate in a better way, in a more seamless way, those more psychosocial, educational, employment-based, housing-based services with the clinical services. So many people have advised me, so many experts have advised me, you can have a Rolls-Royce clinical service, you can have the best possible doctors and psychiatrists. If those other aspects of a person's life who is going through mental illness, those other aspects of that person's life aren't being supported properly, and if all of the services aren't talking to each other to ensure that each of them know what the other is doing, the person really is left well behind the eight ball. MindMatters is now a very well-established program. It's been running, as you know, since 2000, whatever that is. I was never good at maths, 11 or 12 years. And it's proven to be quite a well-established, deeply rooted part of high school operations, now with well over 80% of high schools undertaking the MindMatters program. But before I talk about how fantastic these 17 schools are, I just want to talk a bit about what else we're trying to do to pad out the suite of services and interventions that are available, particularly for adolescents experiencing mental illness. A good deal of our time after the last election, when I was appointed the first ever Australian Minister for Mental Health, it only took us 110 years, a good deal of the time was spent talking very deeply with experts, but also with families experiencing mental illness, particularly quite severe mental illness. And we found an extraordinary array of gaps in services, either because they were services that we've known do the job for some time that had just fallen away in the sort of competition for general government, particularly state government investment, or there were gaps because we're only now starting to understand what sort of interventions work with children, with families and with adolescents. So our budget this year, the biggest ever new investment in mental health, focuses very squarely on children and youth. It does a few things. In the area of children, before I get to the cohort of the population you guys deal with, what we found last year, what particularly I found, was that there was this extraordinary focus on adolescents and very little focus on making sure that children in their early years have the best possible chance to build good social and emotional wellbeing, a good foundation for good mental health during their adolescent years. I said that 2/3 of all mental disorders emerge before 21, or 25% of them emerge before 12. You've known, particularly as educators, so much over the last 10, 15, 20 years. We've learned so much about the importance of the first 5 years in terms of developing good learning skills, good physical health. We haven't focused enough on the importance of those years, particularly 3, 4 and 5, in developing good social and emotional wellbeing. So one of the decisions we took was to change our commitment a few years ago to introduce a universal 4-year-old healthy kids check, to bring it back to 3 on the advice of paediatricians and a number of other experts, that 3 was really the best time to get into this stuff. But also to broaden it from just checking the kids' hearing, their physical development and such like, and look at their social and emotional wellbeing, knowing that on all of the advice I got, that was the best possible time to pick up the emergence of social and emotional disorders and to start to frame some family-based interventions to help them get into their primary school transition. So we've done that. We've built a range of additional family interventions through counsellors, psychologists and also some psychosocial family mental health services that are new in some cases and building on some piloted programs from only the last 4 or 5 years. We were also told time and time again, frankly, by the Australian Research Alliance for Children and Youth, a RACI organisation chaired by Fiona Stanley, that we know, or maybe you know a lot about this, but we know very little about the middle years. At a Commonwealth level, we have, as you know, an early childhood strategy up to 8 and a youth strategy that takes us from 14 up to early adulthood. But those middle years, and I have a daughter in those years and a son about to enter them, those middle years of 8 to 12, as you know, are also incredibly important years as children start to develop a level of independence from their parents and to think about transitioning into adolescence and into high school. I know, looking at my own child, my daughter, that she is exposed to levels of information and experiences way above and beyond the exposure I had 30 years ago. sorry, my voice just croaked then, many years ago when I was that age. And that's a wonderful thing for her education and development and for the education and development of other kids that age, but it also brings with it some real challenges in terms of their maturity and capacity to deal with those things. So we're going to focus very much on those and try and give as far as possible children as they enter adolescence, as they start to build independent lives and as they start to go to high school, a really good foundation for good mental health during those really important adolescent years. In adolescence, in addition to the sort of educational supports that MindMatters really delivers in those crucial adolescent years, we know that we have to build specialist youth-based mental health interventions. Given the prevalence of mental disorders and the risk adolescents are at during those years of experiencing mental illness, we've got to find the best possible way of making sure they get treatment. And we know that kids at that, particularly in their sort of mid to late teens, experiencing mental disorders and perhaps some other associated issues with substance abuse, sexual health and such like, they don't go to mum and dad's GP. They won't go to mum and dad's GP. We need to build services that they feel comfortable with, that they will go to. Headspace is the primary care service that I know has done some really good work with MindMatters, working out how the clinical and psychosocial meets the educational. And that will continue, but it's been a really positive discussion so far, I think. We decided in this year's budget to increase funding there up to almost $400 million to ensure that we have headspace services across the country. That will take a few years to roll out, but we're rolling them out pretty quickly every year, a new tranche. The headspace organisations now will have the financial capacity to beef up their outreach operations to schools, frankly something that I think largely had fallen off the edge of the table because their core funding was insufficient to do that. We're funding Headspace along with Lifeline to develop, which has been launched in the last few weeks, an online and telephone-based counselling service for young people called, imaginatively, eHeadspace. That is now operating 24/7 for 12 hours a day online and for 12 hours a day on the telephone, obviously with a toll-free number. We're also funding Headspace as part of our Tackling Suicide package to be able to do crisis outreach into schools. We know, tragically, still that 2 or 3 high school students every week complete suicide. Obviously a tragedy for the family, but a tragedy and a real risk for the broader community, the broader school community. So very quick crisis-based interventions to deal obviously with grief, but also the risk of copycat suicides is something we're funding Headspace to do over the next several years. So in a primary care and preventative sense, Headspace is very much at the heart of what we want to do in this area, but we also recognise that there's a gap at the acute level. When particularly at mid and late teen level, there is a risk of first episode psychosis. And so we have decided to fund across the country the rollout of Pat McGorry's Early Psychosis Prevention and Intervention Centres, the EPIC model, which provides a very broad clinical and psychosocial model for teenagers, usually at 15, 16, 17, who are experiencing their first episode of psychosis, and if not dealt with early, can be a cause of lifelong disability. So we're doing a range of things to try and pad out the suite of services and supports that youth and their families get during this really critical and formative period of their life. And in ways we're trying to catch up with what MindMatters has been doing now for 11 or 12 years, something very focused on the needs and the preferences and the way in which adolescents respond, not trying to just put a trendy name on an adult mainstream model, really trying to reflect the way in which adolescents think and the adolescents respond. So that's why it's so good to come and talk to MindMatters or schools that are doing MindMatters. I think one of the very early jobs I had when I was first appointed Parliamentary Secretary for Health was to attend a MindMatters program in Sydney. And I've still got a photo on my wall because somehow you photoshopped it so that there's 2 of me in one photo. I don't know how you did that, but it sort of freaks me out a bit when I look at it, because frankly one of me is pretty hard to bear, let alone 2 of me. But it gave me a very good taste early on of the really important work that you do. The 17 schools who are honoured, or which are honoured here today, are a wonderful example of that. 17 out of well over 2,000 schools, I think, undertake the MindMatters program, so a pretty competitive field. And I have to state up front that I had nothing to do with the selection of these schools, recognising that 2 of them operate in my electorate of Port Adelaide. One, I see Meredith here, Woodville High, and I live on the same street as Woodville High. And I'm pretty sure I saw Michael Dalehill from Nazareth Catholic College as well in the western suburbs of Adelaide. But you're all from different parts of Australia, all doing extraordinary work, wonderful, wonderful work to our most precious treasure, which are the adults of our future. So thank you for all the work you do. Thank you particularly for those 7 schools for the innovation you've shown, because what that means is that other schools can frankly copy you. We can learn from you, and we can spread the really fantastic work that you're doing throughout the other